High blood pressure. Hypertension can lead to severe health complications and increase the risk of heart disease, stroke, and sometimes death. Common factors that can lead to high blood pressure include a diet high in salt, fat, and/or cholesterol. Chronic conditions such as kidney and hormone problems, diabetes, and high cholesterol. For controlling your hypertension, there are 2 effective yoga exercises that help lower the blood pressure. Inverted yoga. Inverted yoga reverses the action of gravity on the body. The most profound changes brought about by inverted yoga is in circulation. In inverted poses, legs and abdomen are placed higher than the heart. Lengthening up through the legs and keep them very active so your spine opens and the entire body actively involved in the pose. One of the reasons for this is simply because the force of gravity is reversed and venous return becomes significantly greater. Normally, the muscles of the calf and other skeletal muscles in the lower extremities must contract in order to pump unoxygenated blood and waste back to the heart through the veins. In inverted poses, gravity causes the blood to flow easily back through the veins, and this brings the blood pressure in the feet to a minimum. This in effect gives skeletal muscles a chance to rest. In inverted poses, drainage of blood and waste from the lower body back to the heart is increased and disorders such as varicose veins and swollen ankles are relieved. Rhythmic breathing. It's time to learn about breathing because inhaling and exhaling have the power to nourish the body and calm the mind. Not just any old breathing will do. If you're like most people, you take shallow breaths, pull in your stomach when you inhale, and never empty your lungs of carbon dioxide when you exhale. Here's the physiological explanation: long, slow breaths are more efficient than short, fast ones. To take in a good breath, your lungs must first be basically empty. Thus the key to efficient breathing lies in exhaling completely. A full exhalation begins with the upper chest, proceeds to the middle chest and finishes with tightening the abdominal muscles. Only after a good exhalation can you draw in a good lungful of the oxygen-rich air your blood needs for nourishing cells. Lowering cholesterol. The human body produces oils and other substances that circulate in the bloodstream. An example is an insulin, which is secreted from the pancreas in response to the increase in the amount of sugar coming from the food that the person eats. The cells then absorb this, which gives the individual calories that are used as energy. Another substance that the body produces naturally is cholesterol. This is also ingested in the food people eat. There are 2 types of cholesterol, namely LDL and HDL. LDL is better known as bad cholesterol. The reason why it is bad is that too much of this in the system may put the person at risk of suffering from either a heart attack or a stroke. HDL in simple terms is good cholesterol because its job is to regulate the flow of the bad one, so this can be filtered out of the person's system. There must be a balance between the 2 so the individual is healthy. Whenever people get a blood test, the patient will see a breakdown of the LDL and HDL in the system. Though not that significant as the first 2, doctors pay attention to 2 other figures, namely the total cholesterol and the triglyceride level. In order to be given a clean bill of health, the patient must stay within a certain range. Those who have less than 200 mg per deciliter in total cholesterol are safe. The same goes for someone who has less than 150 mg per deciliter in the triglycerides. So what happens if the person goes beyond the limit? In simple terms, the individual is at risk of developing high blood pressure or heart disease. The good news is that the person can still prevent such a thing from happening. There are 4 simple ways to do it, and this must be done gradually before something bad really happens to the individual. The first is to change the diet. This means eating less of those that are high in saturated fats such as red meat and dairy products. This should be changed for fish, fruits, nuts, oatmeal, and vegetables. Studies have shown that those who eat oatmeal regularly are able to reduce the LDL and triglyceride levels in just 2 weeks. Imagine what could happen if this is done even after just a month. The second is exercise. The body has stored fat after how many years of not engaging in any physical activity. Changing the eating habits can only go so far, and sweating it out will increase the metabolic rate, thus helping reduce the patient's cholesterol levels. The third, which doesn't happen often, is for the individual to take supplements to aid in the reduction of cholesterol. Examples of these are bile acid resins, ezetimibe, fabric acid, niacin, and statins. These are available in different brands, and studies have proven this can lower the cholesterol from 15% to 30% when this is taken in regularly. Should exercise and dieting not work, the patient must remember that the intake of these drugs has certain side effects. The doctor should explain this before even prescribing this, so the individual can choose from the wide range of drugs that can be used to lower one's cholesterol. Prevention is the best way to combat any disease. A regular checkup at the doctor's office will surely save money instead of being confined to the hospital.